Yes, this is Dr. Jerry Cuomo. I'm here with Troy's case, and we're presenting a anterior and partial posterior veneer case. We're going to be removing some pre-existing veneers that have been in place for well over 20 years, and we're at the point now of preparation design. So we're going to go ahead and start for the next 6 to 7 minutes, and then we'll break and come back at the next step. Okay. All right. So we're just going to go through our provisional. And let me get some water on here. And we're going to zoom in. Try to keep our preparation in 3 dimension. And there's our cement layer. Appears to be some type of clear cement that was used with some opaque modifiers. It was reported that originally the veneers were made and no provisionalization was accomplished, so we're going to go ahead and provisionalize that today. And we're going to use a periodontal probe right now. And we're just going to check the thickness. Well, my goal is to try to prep it in to at least 1 millimeter in depth, if not a little bit more, so we can get a better profile. But we need to get the veneer off first to do that. And it appears to be some incisal coverage there. And that goes in about 1 millimeter. From an orthodontic standpoint, this central incisor is out a little bit, so we like to bring it in and possibly match the adjacent tooth. So we can also bring number 9 out, which is the left central incisor. And there's the enamel right there. So we'll stop at that point. Come over to this side. And we'll just repeat the process. Another investigation, what we could do is just remove some of the outer edge of the ceramic, and we can actually check the original color because of the staining that accumulated on the old ceramic. So we'll do that next. It appears to be a C2 today, and my goal is to get him to an A1, 1.5. So I'm just going to have a quick look at the color. And this is C1. And it's pretty close to C1. It's just a little lighter than C1. Definitely not a C2. But there's the pre-op C2 and C1. So looks like my prediction was right on. So we're correct and accurate in that assumption. The stump shade, you can almost see it right now coming through, and we're going to be probably one of the darkest stump shades that we have. So we're kind of off the charts there. We're going to be right about an N8 stump shade, N8. Okay, so all that information is already gathered. Now we'll use a flat end instrument. We're going to see if we can just pop this off here. Possibly pop that off. Alright, we'll give it a try. There goes a little piece down that side there. Open up also here. Okay, close again, Troy. Yep, so it's separated away from the cement. And look at that cement. It's got a lot of like little reflectiveness to it. Kind of neat. Try it again. Yeah. So a little too difficult to remove just by trying to separate. So we'll prepare it in sequence. So what I'm doing is going to a depth of 0.75 with this burr, and I'm trying to go between 0.7 and 0.9 on the full labial contour. Again, we're going to bring it back a little bit if we can. If we want to stay on enamel, that's important. So this initial prep design is key, and getting enough room for the ceramic to mask out this very deep and dark stain that's apparent. Silicone indexes will be next used to check the the reason why we're coming in here with this presented two methods, and one was the veneer, the other was full coverage. Both are good treatments. Certainly with the veneer side, we have to pay strict attention to our veneer parameters. Stay on enamel, the key. So the doctor that took care of Troy's case in the past did prep the tooth, and I'm outlining that now. I'm just removing this appears almost like a metal flake kind of. It's not really made of metal, but it's a metal flake reflective veneer cement, which is has given him the masking ability. Our goal today is to use a luting cement that will also mask this tooth and give it the optical properties that are necessary. Now there's some gingival inflammation related to tooth number 8 that we're documenting from the bulkiness of the margin and its entrapment of bacteria at the neck. what we're going to have Troy do is we're going to keep him on a water pick twice a day, and we'll do a 2-minute in the morning, 2-minute at night, and get him set up for that. All right, now this tooth is just about free from the old dentistry, and we notice that the soft tissue has covered more of the cemento-enamel junction. So we're going to pick this up in the next segment, Dr. Jerry Cuomo.